Childbirth. This presentation will be done by me, Favor Nzagwu. Pregnancy and childbirth-related deaths, a public health priority. Pregnancy-related deaths are a major public health issue in the United States. Our target population are pregnant women, especially women of color, low-income women, and those with pre-existing health conditions. The U.S. has a higher maternal mortality rate compared to other developed countries. Why maternal mortality matters. 700 pregnancy-related deaths per year in the U.S. Black women are 3 times more likely to die from pregnancy-related causes than white women. Maternal mortality rates are rising in the United States, while other developed countries see declines in their mortality rates. Here on the side, I have a graph showcasing the mortality rates from 2018 in different developed countries. So for instance, we have the orange of United States, rising at a 17.4%, and in other places like France is 8.7, Canada is 8.6, the UK 6.5, Australia 4.8, Switzerland 4.6, Germany 3.2, and so on. So this is just showcasing how bad our maternal mortality rate is in the United States compared to other developed U.S. countries. Challenges in health disparities. Unequal access to health care. So there is 1 in 5 women of reproductive age in the United States lives in a maternity care desert, where access to comprehensive prenatal and postpartum care is limited. Racial discrimination and undertreatment in medical settings, especially for Black women. Black women in the United States are 3 times more likely to die from pregnant-related issues than white women, according to the CDC. Socioeconomic factors like poverty and lack of healthcare facilities in rural areas, risk factors such as hypertension, diabetes, and pre-existing health conditions can also be a factor of this health disparity as well. Here's a fact sheet that showcases more on pregnancy and childbirth. So let's talk about the numbers. 80% of pregnancy-related deaths were preventable in the years of 2017 through 2019. 22% of the deaths occurred during pregnancy. 25% of deaths occur on the day of delivery within 7 days. 53% of deaths occur 7 days to 1 year of life. Low-income mothers. United States has the highest rates of maternal deaths compared to other developed countries. Maternal deaths are more common in mothers who have low income and less access to health care, also known as prenatal visits. Black women are more likely to fall under this circumstance as well. The leading causes of pregnancy and childbirth mortality. Mental health issues, anxiety, depression, suicide, overdosing, and sleep deprivation can promote that. We also have hemorrhaging, cardiovascular conditions, infections, embolisms, and hypertension. Here are some interventions that we can do to reduce this public health disparity. Women should find an OBGYN and attend prenatal visits. They should learn and know the warning signs, such as heavy bleeding, chest pain, or difficulty breathing. Self-care is also important. Protect your mental health. Eat a healthy diet and remain active. Monitor your blood pressure. You can find devices sold at pharmacy stores like CVS, Walgreens, even Walmart. Reach out for support whenever needed. Every mother deserves a fighting chance. Did you know the United States had 32.9 deaths per 100,000 live births in the year of 2021. In 2000, maternal death rates was 17.4 deaths per 100 live births. The global average of maternal death rates is significantly lower, and the United States carries the highest rate. Know the risk. Maternal death risk factors. We have chronic health issues such as hypertension, diabetes, heart disease, and obesity, limited access to health care, lack of social support, past medical history such as preeclampsia, gestational diabetes, and C-sections, infections, and also anyone who's younger than the age of 18 and older than the age of 35. Care awareness, health support. Simple tips to be a mama. No smoking or drinking, prenatal care, eat healthy and stay active, advocate for yourself, and learn the warning signs. Stand up for mother's health. Mommy and doctor. Schedule what mommy needs to do. Schedule regular checkups with provider. Keep them updated with any concerning changes and advocate for yourself at all times. Mommy and environment. Make sure you have a safe space for you and your baby ahead of time. Try to tackle things early so you're not stressed about it later. Mommy and family. Set boundaries with your family. Tell them how you would like them to help you. Tell them what you also do not want. Share birth plans with your caregiver. Mommy and mommy. Protect your mental health at all costs. Don't neglect your self-care. Make sure you have someone to lean on, whether family or support group. So here we have some also good sources that we can use for this health disparity as well. We have the Georgia Department of Public Health. They have a Title V maternal and child health services link that we have here. The Title V program administered by the Georgia Department of Public Health focuses on improving maternal and child health outcomes across the state. It provides funding and support for various health services, including prenatal care, child wellness programs, and family planning services, particularly targeting underserved communities. This site links have health programs that are funded by the Title V program in Georgia. This is a good resource for mothers and families to have free sources that are allocated to their needs. We also have the Kaiser Family Foundation, who released the Maternal Mortality in the United States, a premiere. This report from the Commonwealth Fund explains the program of maternal deaths in the United States, including what causes them and how they affect different groups. It looks at the risk factors such as health conditions and lack of proper care that contribute to the maternal deaths. The report also suggests ways to improve policies to help reduce these deaths. The resource is helpful for patients and healthcare providers because it provides important information to better understand the issue and work toward providing and improving care and health outcomes for all women, especially those fighting inequalities. We also have the National Institute of Child Health and Human Development with their link titling Infant Mortality Resources. The NICHD's Infant Mortality Resources page provides a range of educational materials, research findings, and resources aimed at reducing infant mortality rates. It includes links to government publications, prevention strategies, and information about the causes and risk factors associated with infant deaths. This resource is valuable for patients and clients, especially expectant parents and healthcare providers, as it offers reliable, evidence-based information about preventing infant mortality. It helps users understand risk factors, access resources for care, and implement strategies to improve infant health, ultimately supporting healthier pregnancies and reducing preventable infant deaths. We also have the Texas Department of State Health Services, maternal and child health programs and activities. The Texas Department of State Health Services offers programs to help improve the health of mothers and children in the state. These services include prenatal care, child health checkups, and family support, especially for those in underserved areas. The webpage explains programs designed to reduce health inequalities and make healthcare more accessible. These resources is useful for patients and healthcare providers because it connects people to services that help them with pregnancy care, child health, and family support, especially for those who need it the most. Thank you for tuning into my presentation. I hope you have a great day.